Hi everybody, in the last several videos we've been talking about Dr. Bredesen's RECODE protocol for reversal of cognitive decline, which has been a crucial program for my dad. Dr. Bredesen's team has helped hundreds of people reverse their cognitive decline, establish mild cognitive impairment, and Alzheimer's disease with this protocol, as evidenced in successful studies in 2014, 2016, 2018, 2022, and current clinical trials. Today we're continuing on with the Cognoscopy, Dr. Bredesen's diagnostic framework for screening all the potential contributors and risk factors for cognitive decline. All of these tests and lab results paint a clear picture of where a patient stands and helps identify how they got there. It is the foundation for an individualized protocol to be built out for prevention or reversal. On the last episode, we specifically talked about the very important lab marker, total cholesterol. Next up, we're coming over to HDL cholesterol. So, what is HDL cholesterol? Well, let's recap our last video on total cholesterol. Cholesterol is an essential lipid, a fatty substance our bodies need for building cell membranes, making hormones, and vitamin D. It also plays a crucial role in brain development, function, and overall health. It is a vital component of cell membranes, influencing neuronal structure, signaling, neurotransmission, and is essential for myelin and synapse formation. And even though cholesterol has been vilified for decades via the lipid hypothesis, high cholesterol itself is not the problem as much as it is when present in conjunction with insulin resistance. Check out episode 101 for more details on this. If you remember, the total cholesterol blood test measures the sum of HDL cholesterol, LDL cholesterol, and 20% of triglycerides in the blood. But what is HDL cholesterol? HDL cholesterol, also known as the good cholesterol, stands for high-density lipoprotein cholesterol. HDL helps remove other perceived harmful forms of cholesterol, such as low-density lipoprotein, LDL cholesterol, from the bloodstream and transports them to the liver for breakdown. It plays an important role in maintaining healthy arteries by preventing the buildup of plaque and thus heart disease. Other than helping preventing plaque and the narrowing of arteries, HDL has anti-inflammatory properties that help reduce damage to artery walls. It improves blood flow, reduces the risk of blockages, regulates the production and breakdown of cholesterol in the body, and higher HDL levels are associated with a lower risk of heart disease, stroke, and cardiovascular issues. Standard of care's general guidelines for HDL cholesterol are 40 milligrams per deciliter or higher for men and 50 milligrams per deciliter or higher for women. But Dr. Bredesen and his team have seen optimal cognitive health and function with HDL cholesterol levels of 60 milligrams per deciliter or higher for both men and women. Higher HDL levels support brain health by helping preserve gray matter volume, crucial for cognitive function. HDL also helps grow and repair neurons, helps in the clearance and excretion of amyloid beta, suppresses inflammation in the brain and blood-brain barrier, and promotes the production of nitric oxide, a molecule that helps keep blood vessels healthy, ensuring proper blood flow and nutrient delivery to the brain. Now, symptoms of low HDL can present as fatigue and weakness, as it's essential in the production of hormones and maintaining energy levels. Depression and anxiety, as it is also involved in the production of serotonin, a neurotransmitter that regulates mood, and cognitive impairment. The foods that help promote higher HDL cholesterol concentrations are avocados and avocado oil, fatty fish rich in omega-3 fatty acids like salmon, mackerel, sardines, and herring, nuts and seeds like almonds, walnuts, chia seeds, and flax seeds, and extra virgin olive oil. Again, Dr. Bredesen's recommendation for HDL cholesterol is 60 milligrams per deciliter or higher for both men and women. And the surest way to knock our HDL cholesterol levels down and prevent us from raising them to healthy levels is developing insulin resistance. When testing for cholesterol in relation to brain and cardiovascular health, we must always also test for insulin resistance markers. Check out episode 14 for this. Dr. Bredesen has found that insulin resistance is the single most important metabolic contributor to Alzheimer's disease development and progression, and that the biggest drivers of insulin resistance for us are diet high in simple carbohydrates such as sugar, processed food full of high fructose corn syrup, sedentary lifestyles, poor sleep, and chronic stress from work and home lives. But he also found that the antidote to reversing insulin resistance, restoring insulin sensitivity, and improving cognitive function was optimizing the right diet, exercise, sleep, and stress management programs within patients' protocols. These are the core pillars of the RECODE protocol. And the biggest lever in achieving this level of insulin sensitivity is what we eat every day. To learn more about this, please check out episode 16, linked on the screen and in the description below, for a brief overview of Dr. Bredesen's anti-Alzheimer's diet. I've also linked all of Dr. Bredesen's recent studies as well. If you're asking, how do I get tested for these labs to assess my Alzheimer's risk. Check out Dr. Bredesen's website at episode 12, both linked in the description box below for more information. And I'd love to hear from you. Has your neurologist ever spoken to you about HDL cholesterol levels? What do you think of this video? Please drop me a comment. And if you found this information helpful, please feel free to share this video with anyone you think it could serve. And please like and subscribe as it helps our community grow. And remember, I'm not a doctor. I don't have a PhD. I'm a caregiver and citizen researcher on the ground, helping a loved one, someone just like you. This information is for educational purposes only. Please consult your medical practitioner before implementing any changes. Thank you for watching. My dad thanks you. I hope these resources are helpful to you and your family, and see you in the next video. Thanks.